Hi, my name's Drew. I'm the rheumatology nurse here in Glasgow. Today's video is about being given the diagnosis of Juvenile Idiopathic Arthritis, or JIA. Jude has recently been told he has the diagnosis of JIA and he's coming to chat. When we give that diagnosis, you're welcome to come with your mum or dad or a family friend. Today Jude's going to do that appointment on his own. Hello Jude, I'm Drew. You've had some stiff and uncomfortable joints the past wee while, and we've done lots of tests on you, and the doctors have told you you've got juvenile idiopathic arthritis. How are you feeling?
A bit confused, to be honest. I've been fine. I've always been fine, and then suddenly you're telling me that my hands are messed up. Why? Why do I have arthritis?
So, juvenile idiopathic arthritis is a condition where your body has decided to start attacking itself. It can happen at any age, and that's what gives you these swollen and uncomfortable joints.
I'm Gillian, Mia's mummy. Mia was diagnosed at 18 months. When she was 16 months, she developed a limp, which got worse, to the point where one morning she woke up and couldn't stand at all. We phoned out of hours and we were seen and we were told to go straight to the sick kids, because by this point Mia's leg was stuck and we couldn't open or close, and it was really red and hot to touch. Initially I thought maybe she'd fallen or something, we'd hoped that's what it was. That day bloods were taken. She was also given an ultrasound. We were pretty much told then though, because ultrasound had revealed inflammation on the joint, and it was mentioned to us about juvenile idiopathic arthritis, and we were told to go away and give her full dose of ibuprofen and paracetamol for, I think it was 10 days, and to come back and be reviewed in clinic. So when we went back, we were seen in A&E. Luckily that day the clinic was on for the rheumatology, and that's when we got the formal diagnosis that it was juvenile idiopathic arthritis. We were booked in for the joint injection in a few weeks' time. It was wonderful. She was jumping in the cot when she came round from the anaesthetic, completely different child, happy and bouncing. We couldn't get her to sit still. But we thought, oh great, it's back to normal. She's okay again. So kind of hope that was her fixed and this diagnosis was wrong, or maybe it was just a blip.
How long will I have arthritis? Will the medication that you're going to give me, will it cure me, or will this just last forever?
So that's a really complicated question. If we look at all of our young people with arthritis and treat them really well, after a few years we can try them off medication, and for about half of our patients they don't need medication again for as long as we know them. They never lose the diagnosis of arthritis, but it's in remission, so as in doesn't need treatment, they're doing well. The other half still need medication to keep their disease under control, so have good and working joints.
We were given some leaflets about the condition and also about the SNAC charity, which helps children with arthritis in Scotland. When we got the leaflets to begin with, I put them to the side. I didn't want Mia to have arthritis, so I didn't read them. Knowing that she's got this disease and there's certain things that will always, be different. She'll always be on medication. So yeah, I found it really difficult to cope with.
So we know that getting back into activity, whether that's sports or just being active around the house, is really important for making you feel better.
I do karate, so can I still do that with my hands? Can I still punch things?
Absolutely. The only slight thing I'd ask you to do is, if we've just given you steroids, we don't like you doing intense sports straight away, but after that kind of, let's say, 4 or 5 days, maybe a week, we're really happy doing any sport you want to do, as hard as you want to do it.
Is there anything I can do to make my life easier on day to day?
It's really important to try and have a mixed, varied diet, lots of fruit and veg, lots of different types of fruit and veg, because that gives you all your vitamins and minerals that you need to help grow and repair things.
Is JIA something I was born with, or did something cause it to happen?
It's not something your mum did during pregnancy, it's not something you've done either. It just seems to happen in some people. Lots of young people find it really helpful to meet other people that have got the same diagnosis, so they know they're not on their own.
What's helped me accept that Mia's got arthritis is actually, I think, meeting other families who are in the same boat.
So what happens next for me?
So what we want to do is treat your joints and make your joints better so they're not uncomfortable and they're not swollen. That'll involve some blood tests, that'll involve taking some medicines, and because our medicines take a few months to work, it sometimes takes a little while to get to know you and your condition and how much medicines it needs.
What would happen if I really don't want to take the medication and I just don't?
So I really want you to be as honest with us as possible, because if you tell us what's going on, we can come up with a different plan that fits you better. So after all that conversation, do you have any more questions just now?
No.
No?